Hello, I am Dr. Sundeep Upadhyay, Professor and Senior Consultant Rheumatology and Immunology at Indraprastha Apollo Hospitals, New Delhi. So today we'll be discussing on the very important topic of gout. It's one of the commonest metabolic arthritis of the elderly. It's a disease that afflicts the most vulnerable populations, which is our patients with chronic morbidities like heart disease, stroke, people with kidney disorders and the like. How to manage gout better? The management of gout is not just the medical aspect of treatment of gout. The medical management I'll be discussing in the next few minutes. There is a social aspect of treatment of gout as well, or the management of gout as well. And that includes the constancy of keeping in touch with modern and latest information. So what are the risk factors for gout? Very commonly, it's the elderly gentleman who has several comorbidities, heart disease, minor renal problem, who's on various medications including diuretics, antihypertensives, and the diabetes is poorly controlled, for example. That's the real background for a typical patient with gout. And if you throw in some of the other features like excessive alcoholism or extreme obesity or binge drinking, intercurrent illnesses like dehydration, traveling, air travel, long distance travel, all that sometimes plays up, and these factors are associated with gout. What are the triggers for gout attack? I'll make you go through a set of scenarios. You have a young man, say in his 30s, and he goes out partying. He goes out partying all night and he binges on beer, for example. Gets dehydrated the second day. He's vomiting. He has loose motions, and then he drinks again, for example, or has a very hearty meal of meat and a very high calorie diet, and again binges on beer. The dietary factors and drinking is the one trigger for gout, and it's likely that the patient wakes up late in the night with a severe acute swelling of the toe or the ankle or the knee, and that's one trigger for gout. How to manage a gout attack? So the acute attack, the episode of the arthritic gout is best managed with an anti-inflammatory. If one has the services of a casualty or an emergency close to the place where the patient stays, then one should approach the casualty or the emergency. The use of an anti-inflammatory under the guidance of the emergency physician or the rheumatologist, as the case may be, is very important, very vital. Anti-inflammatory drugs along with colchicine, which is a medicine that also dramatically helps with gouty symptoms and takes care of severe symptoms very quickly, is mandated. How is a gout attack treated? Well, most of the times the site of a gout attack is the home. It's late in the night that the patient might develop a severe sudden swelling of a ankle or the foot or the first great toe, and therefore the treatment of gout is most important done in the domiciliary setting, in the home, and that's where information on gout should come in. If the patient has had earlier attacks of gout and knows that these are the rescue medicines that one needs to take, that could include anti-inflammatory medicines along with a PPI or an acidity reducing medicine. Then it's vital that the patient should not wait for the doctor's recommendation, especially if the doctor has explained the domiciliary treatment adequately, the patient can immediately resort to using either a tablet of an anti-inflammatory along with a acidity agent and use it judiciously again in a couple of hours or 3 hours or 4 hours as the case may be, and take care of the gouty symptoms. How to prevent future gout attacks, and what role do medications play in preventing future gouty attacks? Now, if you split this into two, uh, the medical aspect we'll take later. The general aspects, let's first take them. How to prevent gouty attacks on a general basis. So, a healthy lifestyle, losing weight, stopping smoking, low carbohydrate diet, and foods that we'll be discussing in subsequent questions which are prohibited are to be avoided, continue to be avoided. That's important. So that's one aspect of the treatment and avoidance of these gouty attacks. That's what the patient can do. Now, what is the medication or the doctor's role in preventing future gouty attacks? First and foremost, most of the times, if you've had multiple attacks of gout, then it's likely that you need medicines for life. You need urate lowering therapy, that is uric acid lowering medicines, either allopurinol or febuxostat or some other agents for life. And that mandate comes from the treating doctor. So the doctor's role here is to imbibe this knowledge and let the patient know that this set of medicines is for life. The doses that need to be set, the time intervals that the tests need to be done to evaluate whether doses need to be increased, decreased, has to be evaluated and done. Gout diet, what's allowed and what's not. So the commonest problem with gouty diet is that there are more misconceptions than scientific facts. The misconceptions abound, and the rule of the thumb is that most diets that have protein should be avoided. This is the biggest misconception surrounding gouty diet. A diet in normal protein, vegetable proteins are completely okay. Only red meat is to be avoided if at all. And the use of dairy products, paneer, pulses, dal is all okay. Use of products like fruit juices, the products like cola drinks are to be avoided. Beer is a strict no-no. And seafood should be avoided as far as possible. So today we've discussed at length about gout, which is a metabolic disorder. It's a disorder that affects the elderly and the susceptible population of people with cardiac ailments, renal disease, and other comorbidities. We discussed at length about the do's and don'ts, about medications that we should use, what is the right way forward, including how to treat it in the hospital, how to treat it in a domiciliary care setting. And finally, we discussed some of the myths surrounding gouty diet. Stay safe, stay healthy, stay informed. Namaste.